Okay, we have all been there. That weird pain in your gut that just pops up and makes you go, huh, is this serious? It's a feeling everybody knows. So in this explainer, we're going to build a really simple framework to help you figure out what your body might actually be telling you, right? Stomach aches, they're just a part of being human. Maybe you ate some questionable leftovers, maybe it's just stress, but most of the time they're totally harmless and they just, go away on their own. No big deal.
But yeah, that is the million-dollar question. How do you actually tell the difference between a simple, I'll be fine tomorrow kind of ache and something that really truly needs a doctor's attention? Well, that's what we're here to do. We're going to give you the tools to help you sort it out. And the best way to do this is to kind of learn to think like a doctor. We're going to use this simple mental model. Think of it as a triage funnel. It's a really powerful way to check your symptoms systematically, starting with the absolute most critical stuff first. So, our funnel has just 3 simple steps. First, we do an emergency check. This is to rule out any immediate danger. Second, we do what's called a red flag scan. That's for spotting signs that mean, hey, you should probably see a doctor pretty soon. And then finally, we get to put on our detective hats and gather clues for everything else.
So step 1, the first and honestly, the most important filter is for real-deal emergencies. These are the signals that are basically screaming, stop what you're doing right now and get immediate medical help. So what do these signs look like? Well, think sudden, really severe pain that's stuck in one specific spot, or pain that just keeps getting worse and worse over a few hours. A stomach that's so tender you can barely stand to touch it. Or maybe it's new acid reflux that comes with chest pain or pain shooting down your arm, because that could be a heart issue. And finally, any new yellowing of your skin or your eyes, that's called jaundice, that's a definite sign to head to the ER.
Okay, so if you've gone through that list and you're in the clear, we move to the next layer of the funnel, the red flag scan. Now, these aren't necessarily call 911 emergencies, but they are very, very strong signals that you need to call your doctor and get on their schedule soon.
And why are these flags so critical? Get this. One study found that for patients under 55 who ended up having certain types of stomach cancer, more than 97% of them had at least one of the red flags we're about to talk about. So yeah, we've got to take these really seriously.
So these red flags include things like losing weight when you're not even trying to, vomiting that just will not quit, and something called dysphagia, which is a medical term for that awful feeling of food getting stuck when you swallow. Other big ones are anemia, seeing blood when you throw up, or having black, tarry stools. And beyond the symptoms themselves, your personal situation matters too. Like if you're over 60 and these are new problems, or if you have a family history of GI cancer, or you're running a fever that won't go away.
All right, if you've made it through those first 2 filters, no emergencies, no red flags, you've landed at the final step. And this is where you get to become a symptom detective. Your main goal here is just to gather clues that will help you and your doctor crack the case.
You know, one of the very first things a doctor's going to ask you is, so, where does it hurt? And there's a good reason for that. The location of your pain can be a huge clue. For example, pain way up high in the middle often points to things like reflux or an ulcer. If it's over on the upper right side, your liver or gallbladder might be the culprit. And pain around your belly button or lower down can signal anything from a simple stomach bug to something more serious like appendicitis. Now look, this is not a perfect map, there's a ton of overlap, but it is a fantastic starting point for your detective work.
Another key detective skill, tracking your triggers. You gotta look for a pattern. On the food side of things, spicy meals, really fatty foods, or even just coffee can be common troublemakers. And on the medication side, painkillers like NSAIDs, some antibiotics, even iron supplements are known to cause stomach issues for some people. This is where keeping a simple symptom diary can be an absolute game changer.
So after we filtered out the emergencies and the red flags, we finally arrive at what is, by a long shot, the most common reason for persistent stomach pain, a category of conditions called functional disorders.
So what in the world is a functional disorder? Well, it's a condition where doctors can run every test in the book, scopes, scans, blood work, you name it, and find absolutely nothing physically wrong. No ulcer, no inflammation, no visible disease, but, and this is the most important part, the pain,
the bloating, the discomfort you're feeling is 100% real. It is not all in your head.
And how common are these things? Just think about this. Functional disorders, like IBS, account for about half of all referrals to digestive specialists. Let that sink in for a second. Out of every 2 people who get sent to a gastroenterologist, one of them has a condition where tests show nothing. It is a massive piece of this puzzle.
And this brings us to a really crucial distinction in medicine today. On one side, you've got organic disorders, like an ulcer or IBD, that have a clear physical cause that a test can find. But on the other side, you've got functional disorders, like IBS. And the diagnosis for those isn't based on a lab result, but on a specific pattern of symptoms, which is exactly why all that detective work you've been doing is so incredibly valuable.
This whole thing has led to a major shift in how experts think about these conditions. They're actually moving away from the term functional disorders and starting to use a new and frankly much more accurate name, disorders of gut-brain interaction. And that name change, it's more than just semantics. It's a whole new way of looking at our own bodies. It reframes the problem. It's not about a faulty stomach anymore. It's about a miscommunication, a glitch in the very complex conversation that's always happening between our gut and our brain. So maybe the next time you feel that ache, the question isn't just what's wrong with my stomach, but what is this conversation between my gut and my brain trying to tell me?